Good afternoon, everybody. Happy Wednesday. Once again, hope everybody is safe, sound, um, clean, and virus-free. Um, a couple questions came up about what we were talking about yesterday. I wasn't sure if I addressed them enough, so I want to just readdress something from yesterday. If you have had exposure to the virus SARS-CoV-2, you would develop antibodies to the virus. Depending on the exposure, depending on the person, depending on your own health status, depends on how much of an immune response you will develop, that will occur inside your body. In other words, to keep it simple, how many antibodies you'll produce. Whether or not you have the disease, you will produce antibodies. We do not know enough about this virus to say for certain if the antibodies that you do produce will protect you from a second infection. There's some news coming out that in another country and on a military ship of the United States, people who tested positive for SARS-CoV-2 and cleared the infection apparently tested positive again. So it appears as if they were exposed to the virus, they produced antibodies, and they had the infection again. Now, what's important to note is we don't know how many antibodies they produced in the first place. We don't know how strong an immune response they had in the first place. So we don't know if that had anything to do with whether or not somebody produces antibodies, or, excuse me, if we don't know if there are enough antibodies to stop a reinfection. We don't know if antibodies stop a reinfection. So when we develop these vaccines, and if you watch the news close enough, you'll find that there'll be very optimistic viewpoints on the vaccine productions, vaccine testing, vaccine studies, and you're going to find pessimistic opinions about those too. Once the vaccine is produced, once it's found safe to use, and once it's in its second and then third clinical trial, where there's a large number of people who have received the vaccine, we then need to find out when the vaccine causes antibody production inside you, inside the test subjects, the volunteers. How long do those antibodies last, number one, and two, do the antibodies actually protect you from an infection? And number three, if they do last and they do protect you from an infection, how long do the antibodies protect you? Do they protect you for a day, a week, a month, a year, 3 years? Some vaccines that we have given out for different viruses, different pathogens, we thought offered a lifelong immunity, and we were wrong. Pertussis is an example of that. Some we know last a year because of the way the virus mutates. Influenza is an example of that. Somewhere in between short immunity and forever immunity is going to lie a vaccine that is coming out for COVID-2. Way too early to decide which vaccine is going to hit the market. But because I've become more involved in social media than I ever was in my life, in other words, starting to do these videos, which I'm happy to do, I'm disappointed in how much negativity there is out there, how much misinformation there is out there. One particular comment, question was, how do I explain facial coverings to somebody who states that the virus is too small to be caught, blocked by a cloth facial covering or even a surgical mask? Well, the answer is the facial coverings are to stop the moisture coming out of your mouth and nose, because if you are a carrier of the virus is being carried by your saliva. The facial coverings are blocking the saliva droplets. The virus is stuck in the saliva droplets. So if you block the saliva droplets from leaving the mask or facial covering, you're preventing the virus from spreading. The part two of that is, no one is saying that a facial covering is enough to protect others from getting infected with SARS-CoV-2 and ultimately coming down with COVID-19. The facial coverings are only part of it. We need to use facial coverings to protect others from the moisture coming out of our mouths, carrying virus to them. We also need to wash down surfaces frequently. If we touch a surface, we need to wash our hands, right? 20 seconds, rinse and repeat is my suggestion, but CDC is recommending 20 seconds of warm soap and water. Why? Soap kills it. Soap kills this virus. How many times have I told you? Soap kills the virus. Soap kills the virus. We wash down all our surfaces with soap and water, and the virus dies. If we don't, and we touch the surface, and there was SARS-CoV-2 there, we touch our face, we get the virus. We touch our eyes, we get the virus. We eat a sandwich, we get the virus. Social distancing is very important. Imagine the virus is a feather, okay? Imagine it's a feather. It's much lighter and smaller than a feather. If I was standing 6 feet from you, right, and I took that feather and I threw that feather at you, you know where that feather's going? Down here. And it's going to float around, and it's true, we know that about this virus. This virus sort of floats around. Some experts have said 8 seconds, 18 minutes, different numbers. Imagine the virus coming out without being attached to moisture. Well, the virus sort of floats there and it probably won't get too close to you. Imagine that feather though, I take that feather and I glue it to a tennis ball. The tennis ball is like the moisture, right? Now I have that feather and I have that tennis ball and I toss it at you. Well, guess what? That tennis ball is going far and it's going to hit you. The virus attached to the moisture coming out of your mouth is like that feather attached to the tennis ball. We may not be able to stop that feather, but we can stop that tennis ball. And if we can stop that tennis ball, that feather's not going anywhere. The only other thing I'll recommend to those people who said, how do I approach somebody who says the virus is too small to be caught by a mask or a facial covering, is before I try to be understood, I try to understand. Where is this person coming from with that argument? Why are they coming from that direction with that argument? I come across this all the time in the clinic. Why do I have to take a blood pressure medicine? Why do you have to wear a facial covering? Well, I suppose you don't have to. People argue that, we should go into gyms because it's our constitutional right. I respect I'm a U.S. citizen. I respect the Constitution of the United States. I respect the Bill of Rights. I respect the office of the President of the United States. What we do for our neighbor to protect them goes beyond even the Constitution of the United States. I protect my neighbor by wearing a facial covering when I go out and when I'm in the office, when we're not this far away from each other, because the Constitution of the United States says I don't have to wear a mask, if I interpret it that way. The Constitution of the United States says I can walk into a store and not put on a facial covering. Well, my duty as a citizen of this country, this state, this county, as a Christian, is to protect my neighbor. And protect my neighbor regardless of my right. I'm glad I have rights. I'm glad you have rights. I'm glad that we can go into a gym, a restaurant, I'm glad we can fight for those rights. The rights are very important to maintain our freedom. But if you understood that walking into a hardware store and you might be a carrier of COVID-19, of SARS-CoV-2, and there are people that if they caught it from you, they would die, I don't think you would walk in there without a facial covering. It's your constitutional right to walk into that store without a facial covering. But do you really want to harm somebody while you're protecting those rights? If you knew what you were doing, if you knew the risk to others by your actions, I don't think you do it. I think there's a misunderstanding out there because the media, as I said, social media as well as mainstream media is confusing this whole thing. We simply have a respiratory virus that is spreading around the world. People are carrying it, don't know they have it. People are dying because they're over 65 years of age. That is not fair to them. And there's other risk factors, as you know, and we talked about that in the past. The World Health Organization has just announced, I just got buzzed on it. There were more deaths in the world, excuse me, I apologize. There were more cases in the world reported today in the last 24 hours. There have been more cases than there has been in the entire pandemic. We're not done. Work out at a gym. Remember to stay way more than 6 feet apart as you're huffing and puffing. And this vapor is leaving your mouth that's potentially carrying COVID too. Wear a facial covering as much as possible. Stay away from people. Keep everybody safe. If you're 20, 30, 40 years old and you're healthy, 50 years old and healthy, you're probably just a carrier and you're not going to die. But you, 20, 30, 40, 50, healthy, as a carrier, are going to carry it to someone who's over 65 or other health conditions. And they'll be sick, they'll be intubated, and they'll die. Because we're not done. It looks like we're done if you look at the media. Everything's opening up, and I get it. Financially, I get it. I'm a business owner myself. I'm in a private practice, solo practice. I get it. But we're not done. The virus is not done with us. We have no vaccine. We have no treatment. And before I say goodnight, I recommend that you have if you don't have one already, get a primary care physician, family medicine doctor, internal medicine doctor, general medicine doctor that you trust and you can talk to. Please get your medical advice from your personal physician, from your private physician, from your general practitioner. Please do not get medical advice from a non-physician. Get advice, but get advice from wherever you want, because it's a free country. Take the medical advice from your primary care physician. Respect those in authority is my recommendation. No medical evidence to support that, my recommendation. But get the pertinent medical advice, get the advice that you want to follow from a primary care physician that you trust. And if you don't trust your primary care physician, get another primary care physician. But get one that follows evidence-based medicine, because that will keep you healthy, along with a good diet, along with exercise. Have a good night. I pray you're all safe. I look forward to talking to you tomorrow. Please stay virus-free. Thank you.